Well, Sarah, here we are again. Ready
Mm,
for the theme of the month for May, which is interpreters. We hope you found last month useful when we talked a bit about complaints and answered some questions and gave you some tips for the week. So this is just introducing interpreters for this month and really why use them. I mean, Sarah, let's start with standard, shall we, and talk a little bit from there.
yeah, so the use of an interpreter is in the CSP standards. It's also in the HCPC, and it's also in the osteopathic standards, where it says that you need to use an interpreter if it is required. And so why do we need to use them? So
And I
why?
think, I think the thing is, isn't it? It's really one of the biggest things is that you're making sure there's not a misunderstanding because of the language barriers and
Yeah.
making sure, because if there is a misunderstanding, think about informed consent.
I know. So it's about gaining, making sure that you do gain informed consent and that the patient really does understand the risks and benefits, the opportunity to ask any questions and to decline treatment. So it's very important that they are there so that the patient is fully informed and can do shared decision making, talk about goals, talk about all of those things. So that's why the use of interpreters is really important.
And also, if we're thinking about it, if we're talking about making sure that things are accurate and that the communication is really effective, then in some cases you're bound to have to use an interpreter. And it is really important that we get the right person, because otherwise, how do we know that we've delivered safe care? How do we know what conversations being had? So
Yeah.
I think, they're crucial, aren't they?
Yeah, they are crucial. And we're going to be talking about, there's going to be other tips of the week that we're going to be talking about using why you can't use family members. We're going to be talking about is it protected characteristic and how you would use an interpreter if you needed to do so. So, yeah,
See
okay.
you again soon. Bye.